Hi, today I'm going to be talking about COVID-19 in older adults. As we all know, COVID-19 was a worldwide pandemic. It was a very serious public health issue. There was rapid spread, and it was a very highly contagious disease. Because of this rapid spread and how highly contagious it was, there was a nationwide social distancing mandate. There was also a mask mandate, and we also experienced lockdowns, which unfortunately contributed to loss of jobs. Businesses closed down, and we saw an increase in unemployment rates. COVID-19 affected millions of people in several different ways, whether it be sicknesses, loss of jobs, or even in serious cases, many people have died from it. With COVID-19, there is a very wide range of symptoms. They go from mild to severe. And very recently, we've experienced vaccines that were created to help with stopping and preventing COVID-19. They also helped with relieving the symptoms for it as well. Older adults are affected by COVID-19 for several different reasons. I am designing this initiative specifically for older adults and how they are affected by COVID-19. There was a study I found that said, drawing on findings from a survey of more than 18,000 adults aged 65 and older in 11 high-income countries, we show how COVID-19 has affected the economic security of older adults, as well as their access to health care and supportive services for chronic conditions. Older adults are at very high risk for COVID-19 complications, more than young adults, and this is for several reasons. The CDC says that older adults who are unvaccinated are more likely to be hospitalized or die from COVID-19. There are preventative measures that there are to protect themselves, such as vaccines, wearing a mask, social distancing, and washing their hands. Older adults have also been affected because of the limited access to care for all health conditions. The COVID vaccination rates for older adults were highest in countries where vaccines were most widely available. Because of the vaccines being made so quickly, there was a lack of trust in the government and concerns of side effects. Older adults with chronic conditions also canceled or postponed their doctor's appointments because they were either afraid of getting sick or they canceled because of limited services available for them. So people did not get the help that they needed. Also, percent of adults age 65 and up with 2 or more chronic conditions who are reported they had an appointment with a doctor or other healthcare professionals canceled or postponed because of the coronavirus pandemic. So we see it is very hard for older adults ages 65 and up to get into their doctor's appointments, whether it be fear or because of limited services available. There is also considerable social and economic hardships that older adults face because of COVID-19. They suffered most economically from COVID-19 by either losing a job or using all or most of their savings money. There was a study that said that the percentage of older adults in the U.S. reporting that they used up all or most of their savings or that they lost their job or source of income because of the pandemic were 4 to 6 times those for Germany, Switzerland, the Netherlands, Norway, and Sweden. Also, Latino and Hispanic, also Black older adults in the U.S. have been far more likely than white older adults to experience significant negative economic consequences. So we see that the racial and ethnic groups these minorities did experience significantly more economic consequences than white people did. Here is an image I found from the CDC for older adults and how they are high risk. It says 8 out of 10 COVID-19 deaths reported in the U.S. have been in adults 65 years old and older. So that is a very unfortunate statistic for older adults in that population. It is very unfortunate, and I will continue to go more in depth as to why older adults are most affected. This is a slide showing advice for older adults, and people with underlying health conditions are more susceptible to having complications with COVID-19. So avoid public gatherings. Make sure to keep the house stocked with at least 2 weeks of significant food supplies and medicine. Also ask help for family or neighbors so that older adults do not have to leave the house and be exposed to anyone who may potentially be sick. So how are older adults unique from other communities? They are higher risk for complications because of their aging process. As you get older, your immune system decreases. So there are different immunological components, so T cells and B cells decrease. They cannot keep up with a virus, which is still kind of a mystery. The virus is constantly evolving. There are different variants that are evolving, so it is very hard for older adults' immune system to keep up with it. Also, underlying conditions play a huge role with older adults and their susceptibility to becoming sick and having complications. How is COVID-19 similar to other public health issues? I think that COVID-19 is most similar to the flu. They are both contagious respiratory illnesses and affect the lungs and breathing. It also spreads to others very quickly. Symptoms for both of them can be asymptomatic, mild, severe, or even fatal at times. And something very similar to both of them, as they both had vaccines created. We see the COVID-19 vaccines such as Pfizer and Moderna, and then we also see that booster shots are available when people are eligible for them, just because of the different variants that are constantly getting created. And then we also see the flu. You hear all the time about the flu shots, and these are available for preventing dangerous types of seasonal flu and reduce severity and the duration of it. It is very important to address this issue right now with older adults, especially because COVID-19 is very much still prevalent. Death cases are high for older adults still. We do not see them decreasing, and we want to prevent them from getting sick and help them to continue to get back to their original lifestyle pre-pandemic. We want to help them feel protected with their safety, with not getting sick with the virus, so they're not fearful and so they can get back to normal life. Steps to take to address the issue would be to make vaccinations more accessible. We can maybe provide an at-home resource for them so they feel more comfortable staying in their own home instead of being exposed and going outside. Also need to make offline accessibility for these older adults, because it is harder for them to set up appointments for vaccines or even for COVID testing online, since online resources are a lot harder for older adults. So if we make things a little bit more accessible for them without using the internet, it might be easier. We also can provide masks, gloves, and hand sanitizers for all, so that they can use this personal protective equipment to keep them safe. Also, there is instrumental activities of daily living that needs to be addressed with all older adults, such as housework, meal preparation, medication, management, or shopping. So we need older adults need help with these things, and with this, provide more access to caregivers to help for this. So we can also offer some sort of meal prep delivery service for older adults to drop off food at their home, so they don't have to go to the grocery store and expose themselves. Then for this, we need different resources such as vaccinations, which require money. We need people to provide these vaccinations, and we also need transportation if we were going to offer them in-home. We also need resources for the personal protective equipment such as masks, gloves, and hand sanitizer. Unfortunately, there is not a time frame that I can give for how long it will take to implement the initiative and how long it will take to see results. It's going to take a lot of time to be consistent in order to see results, and there is an unknown timeline because of the different variants of COVID-19 that continue to develop. Vaccines and new boosters are continually evolving. So adaptations are kind of based off of that and how well these work out for people. And I think also that fear will ease for these older adults as researchers continue to see the effectiveness of vaccines and as research continues to grow about COVID-19. How to evaluate if our initiative is successful or unsuccessful is to look at polls and increasing or decreasing sick or death rates of older adults. We can also observe different vaccination statuses of older people and see if they're more comfortable with getting it. And then we can also create different surveys to see whether older adults feel more comfortable resuming to normal daily life pre-pandemic, or if something like our meal prep delivery services are beneficial for older adults rather than going grocery shopping and exposing themselves. And here is my last slide of the references that I found all of my information from. Thank you.